In the name of Allah, the most merciful, the most gracious, and most compassionate, we start this episode by discussing some of the conditions that allows the Muslim to break his fasting in Ramadan. Of course, we say that he might consult an able, accredited Muslim physician that discusses with him and then will allow him to break the fasting of Ramadan. One of the conditions that allows this is fever. When the patient has fever, especially if it is a very high fever, over 39 or so degrees centigrades, the body cannot withstand the fasting, especially of fluids, due to the fear of subjecting himself to dehydration. All acute conditions of inflammation or infection, like sore throat when it is severe, like mouth ulcers, like acute bronchitis, empyema, lung abscess, cystitis, pyelitis, and orchitis, prostatitis, open TB, all these conditions, the patient has fever. And this will lead him to the fear of having dehydration, and so he has to have regular fluid supply to have his hemodynamics in stable and healthy conditions. Of course, we know that in sweating, which is accompanying the fever, the body loses much of his salts and water, fluids, and he has a concentration of the blood more, and the viscosity is increased, and this is dangerous to his life. The ample supply of fluids is required, and also he is not allowed to have heavy meals, but allowed to have small divided meals all over the day. And this is, of course, cannot be done when he is fasting. Also, one of the most important factors is during fever, the patient has to take some medicines in regular ways, in regular timing, which could be every 4 hours or every 5 hours, 6 hours, and so on. And this is contradicting with the timing of fasting of Ramadan. Of course, we know that the defense mechanisms of the body are recruited immediately to fight against whatever the cause and the reason, the etiology of this condition. And these mechanisms need to have supply of energy, which is given to the patient by some fluids, intravenous fluids, for example, or by allowing him to swallow some sort of sugars like glucose, and this will cannot be done by during fasting. We know that we have to give him medicines, and some people ask, why do you advise the patient to take this medicine before the meal, and why you advise him to take it during the meal or after the meal? And the answer is very simple. To give him the medicine, to advise him to take the medicine before the meal, this means that we want this medicine to be absorbed as quickly as possible, as fast as possible, and as at large as possible. And this could be facilitated by the emptiness of the stomach. When we advise him to take the medicine during the meal, then we want to protect his stomach, the wall of the stomach, from the medicine itself. For example, if you are advising him to take a tablet of aspirin, and if his stomach is empty, then this aspirin will be in direct contact with the gastric mucosa, and this will ulcerate it or make hyperemia or dangerous to this gastric mucosa. The last condition, when we advise him to take the medicine after the meal, here we are protecting the medicine from his stomach, because the stomach pours the acid and the enzymes and so on, which could be affecting the medicine itself and decreasing its effectiveness or even abolishing it at all. And that's why you ask him to take the medicine after his meal, whatever it is. If it is the breakfast or the suhoor, then he has to take it after the meal. And by the way, we say that for the sake of fasting, we allow him to take some sort of drinks which are famous in Ramadan, like arsus or tamr hindi, because these have the effect of antagonizing the thirst sensation, and they are allowing him to have his body fluids retained in it. Because we know that arsus has the same effect like cortisone, which is keeping the body fluids inside the blood, and this will be very helpful in cases of fevers. But anyway, for a small degree of fever, low degree of fever, patient could fast, but again he has to ask the accredited, the able Muslim doctor, who will advise him that his condition is not that severe to let him break his fasting. Also, of course, we know that in cases of gastroenteritis, where the patient also suffers from diarrhea and vomiting, beside the fever, then he loses the fluids either from the stomach by vomiting or from the intestines through this diarrhea. And of course, we know that in this gastroenteritis or enteritis or gastritis, the condition could be severe, and of course he is not allowed to continue fasting. Some patients willing to obey the Islamic religion too strictly by fasting in spite of the fact that this is dangerous to them, and I think that this is wrong and absolutely wrong, because your body, you are not able to threaten it yourself, but you have to keep it by breaking the fasting of Ramadan to keep your body, to keep your health, to keep your life, which is the advice and the order of God to save his body and treat it as well and as the best as possible. For this, in cases of gastroenteritis or in cases of pyelitis or severe conditions of the urinary tract infections and so on, especially if it is accompanied by fever, the best way is to break the Ramadan and obey your doctor, because this is for the benefit of your health and of course for the benefit of your Islamic religion itself. Thank you very much.